Hello, and welcome to the final day of the City of Austin panel series on homelessness. My name is Laura M. Foss, and I'm the Homelessness Communications Priority Lead in the City of Austin Communications and Public Information Office. The City of Austin is hosting a series of 3 panels to discuss the past, present, and future of the issue here in our city. Today's topic is innovations and what's on the horizon, featuring leaders from Mobile Loaves and Fishes, Family Eldercare, the UT School of Pharmacy, and the City of Austin's Office of Design and Delivery. And today's panel is moderated by Taylor Cook from the Design Institute for Health, a collaboration between Dell Medical School and the College of Fine Arts at the University of Texas at Austin. This past Monday's topic was Understanding the Crisis and How We Got Here, featuring leaders from Austin Public Health, SAFE, Integral Care, and LifeWorks, and was moderated by Catherine Flowers from the Dell Medical School, a program administrator in the Department of Psychiatry and Behavioral Sciences. And Wednesday's topic was What's Happening? Programs in Action. And we were joined by leaders from ECHO, the Other Ones Foundation, the City of Austin's Homeless Outreach Street Team, and the Office of Sustainability. And it was moderated by Judy Maggio from Austin PBS. You can access all of the panels on the ATXN archive at atxn.tv, on YouTube, and on the austintexas.gov/homelessness Get Involved page. Homelessness is a complex, adaptive problem that touches every major city in Texas, including Austin, with numerous agencies and nonprofits working to tackle the root causes and meet people where they are. While the issue of homelessness is unique to every community, technology and innovation can help fill in the gaps. We're delighted you've chosen to join us today and tune in to learn about plans in motion, innovations that are in testing, and new approaches to addressing homelessness in our community. At this time, I would like to introduce our moderator for today, the Design Project Manager at the Design Institute for Health, Taylor Cook. Taylor?
Yeah, thanks, Laura, and thank you everyone who's joining for this panel today and for our panelists. We're really hopeful that this conversation about the innovations that are underway in Austin will leave everyone with a sense of hope and really inspired to get involved with solving some of these serious problems that we've got in Austin around homelessness. So to get us started, I just wanted each of the panelists to introduce yourself, tell us a little bit about your organization, and start inspiring us by telling us what big question you're trying to answer about homelessness. And we'll start with you, Mark.
Hey everyone, I'm Mark Jankar. I'm a user researcher with the Service Design Lab for the City of Austin. That's within the Office of Design and Delivery. And I've been fortunate enough to work on some programs and prototypes that the city has addressing homelessness, such as the Leave No Trace Encampment Outreach Program, the Violet Bag Encampment Garbage Collection Program, and the new Keep Safe Storage Facility for people experiencing homelessness. And really what I want to address today and talk about is what is the city's role in addressing homelessness and how we can best do that.
And thanks, Mark. Now we'll go to Tish. Tell us a little bit about yourself and what the big question is you're trying to address.
Good afternoon. I appreciate the opportunity to be here today. I am Tish Moczygemba, and I am a health outcomes researcher at the UT College of Pharmacy and Texas Center for Health Outcomes Research and Education. The question my team is trying to tackle is how can gaps in care and poor communication between people experiencing homelessness and health and social services providers be mitigated. Early in my work with people experiencing homelessness, I learned a lot from homeless care providers who would share with me their issue of losing contact with their clients or patients. And this would come up again and again, and it still comes up today. Also at that time, case managers would tell me how their clients were beginning to have cell phones. Since then, the adoption of cell phone has expanded to where it is nearly ubiquitous across all types of groups and settings. And staying in touch with people experiencing homelessness can be hard for many reasons. The fact that a cell phone and services like text messaging can reach anyone, anywhere, there's great potential for this cell phone to transform the way that we communicate with homeless individuals to meet needs. From a big picture perspective, my team works with community stakeholders, including people experiencing homelessness, to develop, implement, and test the use of smartphones as a tool to improve health outcomes and meet social needs.
Thanks so much. Chantelle, how about you?
Yeah, hi everyone. My name is Chantelle Goche. I'm a director here at Family Eldercare, in charge of financial and housing stability. What questions are we trying to answer is how to design successful programs with short-term homeless assistance for people on fixed incomes. Trying to answer how do we create and design programming, innovative solutions to combat homelessness and to address those individuals that are aging and are on fixed income.
Yeah, thanks, Chantelle. That's hugely important work. All right, and last but not least, Alan.
Yep, there we go. Glad to be here. Alan Graham, CEO, founder, Mobile Loaves and Fishes. And I'm going to call dibs on those three previous questions too. Those are great ones. And I'm going to add in there aging in place. Chantelle and I go way back, Family Eldercare and Mobile Loaves and Fishes. And our efforts really began to lift people up off the streets that could live independently. But that's not really what's going on. Our average age out here is 58 years old. 65% have 2 or more comorbid diseases. Our average age of death is just under 60 years old. And oftentimes when people get really sick, they have to leave their community here, the Community First Village, and go somewhere across town where they don't want to be. And so our big challenge here in the relative near term is how can we create an environment that allows people to not only age in place, but to die in peace here. And really appreciate being here and with this esteemed panel. Thanks.
Yeah, thank you so much, Alan. So my first question then is for you, Alan and Chantelle, excuse me. We know that innovation is a process. So I'm curious to know what your journey's been like for your programs, and then what are some of the lessons that you've learned along the way? And I'll start with you, Alan.
Yeah, oh boy. Our vision goes back 15 years and a lot of drama along the way related to all the not in my backyard people that love what it is that we all do, but don't want it anywhere near where they may live. And so I would say that one of the lessons that I learned along the way is how difficult that roadblock actually is to overcome. We did it because we just moved a hair outside the city. We share property lines with the city of Austin. We're able to get utilities, water, sewer, and electricity from the city of Austin and Capital Metro bus transportation. But because of no zoning in the county and the state of Texas, we were able to not have to go through the gauntlet of the not in my backyard experience. We kind of, what we started and we opened about 5 years ago, we actually analogized this to building a 747 in flight. And there's a lot of learning that's been going on along the way. And I feel like that in the early days, the plane was pretty wobbly, and now it's pretty straight with a little bit of movement around. And as we continue to scale and grow larger and larger and larger, how do we continue to maintain the relational intimacy that we actually have here in the village? And we have some pretty exciting things that are going to come up during phase 3 and 4, which is another 126 acres that we're planning with 1,400 homes. And then I will tell you that the gaps in mental health and physical health care and substance use disorder is going to be a big one that we're going to address. So, yeah, there we go. Shontell, my partner.
Yeah, over to you, Shontell. Same thing. What's your innovation journey been like?
Yeah. Well, yeah, thank you. Family Eldercare has been in the aging services arena for nearly 40 years. We have been providing basic support services for older adults, with our focus being on homeless prevention, one, financial stability, and to create environments and support for individuals to maintain living independently in the community. We have served homeless older adults, going back, 40 years. Over the past decade, we have seen more and more folks coming into our services and presenting with needs that required us to reshape our services to meet those needs. Affordable housing is obviously a huge barrier for the folks that we serve. Support services that specialize in older adults, addressing their medical needs, mental health needs, being able to assess what their functional limitations are to better shape and design programs. We got into the housing business, I suppose, way back in 1998, when we created the Elder Shelter, and it was a shelter designed to provide temporary housing to older adults. And we were wildly successful. At one point, we had 21 units around Austin, and were able to transition older adults from the streets, into permanent housing. We ended up having to close the shelter because of funding and the skyrocketing cost of housing in Austin, and which led us to, again, creating programming to provide wraparound services to meet individual older adults' needs. Our services are layered, and we find that with layering our financial management services, such as payee and fiduciary services, with our homeless prevention services and our benefits enrollment, that we provide this wraparound layering of services that is there for the individual, and sometimes lifelong. We're able to, through our programming, able to serve individuals for as long as they want. We currently have folks that have been with us 25 years, and they are better off because of the services. They're financially stable and housing stable.
I think it's particularly telling, your anecdote or your story about needing to close down the shelter because of the cost of living here is so high. And so I think it brings home the point that innovation is so critical, just because things are changing and growing all the time here in Austin. So I've got a question then for you, Mark, and Tish as well. So you are both doing innovative projects as part of your jobs with the University of Texas College of Pharmacy and the City of Austin, which are larger public institutions that maybe aren't always known for being terribly innovative or quick to innovate. So I'm interested to know from both of you, how is it that you've been collaborating with people experiencing homelessness and frontline workers to help spur an innovation and develop these projects? So I'll start with you, Tish.
Thank you. My team has conducted 2 feasibility studies in Austin, and we did those to sort of focus on this proof of concept with regards to using smartphone technology in terms of answering basic process questions like, will it work? Will people hold on to the phones? What does that mean? Before we could even get to further steps about how it might impact outcomes. And so the best way I like to describe this is that in order for me to be successful as a researcher in moving the needle on outcomes in homeless individuals, I have to get out in the community and talk to people. So it's not staying in my office and sort of, reading all the literature that I can find. And it's so important because if sometimes we refer to interventions, what will stick or stickiness. And we have to know what this context from the local area to be successful. And that's certainly what we've seen here with regards to these interventions. So this is community-based work. We recruit from churches, and all along the way, we have been working with stakeholders to develop and execute the feasibility studies. One of our primary partners is Sunrise Navigation Center, and their staff had direct input into the way that we implemented the types of text messages that we incorporated. And we even met with groups of homeless individuals to get their feedback as well. And there are many things that I think are responsible for where we're at today that has come directly from community input. So for example, this is an example of something that's simple that I'm always like, why didn't I think of that? So in our processes for distributing the phones, we have the cell phone, a case, all those things. But of course, we want to make sure that it's easy for people to keep the phone on their person and have it with them at all times. So a very simple suggestion that someone in the community made was, hey, could you also just provide an armband? So that way somebody could just put it up their arm under their sleeve or wear it on their leg or something like that. And so that was something that really resonated with some participants as being useful. Another example is how the transportation and staying connected, how we want, as the research team, we want to stay connected with our participants, but we want them to be able to get to us and come to appointments and that type of thing. So a community partner, they said, is there a way, bus passes make sense. So is there a way that we can do that? And so what we did was load the Cap Metro app and have monthly bus passes where people could get around and get to our visits. That ended up having benefits beyond just getting to study visits because they were able to meet a lot of other needs too. So that idea of coupling the transportation piece on the phone, that's another example of how this intervention was really advanced from community input. And so, the bottom line is one of the reasons we've been successful and being able to maintain contact is from that community input. Otherwise, all this time and energy that go into interventions can sometimes just really fall flat and miss the mark.
Great, thanks so much. And I appreciate the pitch there for transportation and access to transportation. That just facilitates everything else. You've got to get around. All right, Mark, same question for you. How have you engaged with people experiencing homelessness and frontline workers to help promote innovation?
So one of the biggest principles of civic service design or user-centered design is having the user be focused at all times on your outcomes and building things with people, not just for them. So when we did the Leave No Trace encampment outreach pilot, it was all about developing a communication mechanism with people in encampments and trying to work with them to have their environments safe and allow them to safely remain there. And also communication mechanisms between the outreach social workers, the parks employees, the watershed employees, and APD and other network support that could be in the picture. And what we observed in that pilot doing encampment outreach is that a lot of people were requesting garbage bags and saying that if we had garbage bags and someone would pick them up, we would love to keep our area clean and safe and healthy. So we were giving out garbage bags and people were putting them near garbage canisters that were already there. And sometimes they'd have to walk a long way to do that. So that gave us the idea for doing the violet bag encampment garbage collection pilot. So that started with 3 kiosks that were welded together. We designed it how it was going to work. There's a kiosk where you could take a garbage bag out And then you leave the garbage bag there, and we work with Austin Resource Recovery on adding pickup schedules to where these people could, leave their garbage and then it would get picked up. And we found that to be wildly successful and expanded the program out to, there's over 25 kiosks now all around town where people can, in encampments, have a mechanism to keep their living environment clean and safe. And during the COVID response, those kiosks have become hubs for hand sanitizing stations and food distribution locations for the Cities Eating Apart Together initiative. So that's been really cool to observe happen. And for the storage program, we have a storage facility. It's 140 bins at 12th and Red River that's available to anyone experiencing homelessness to get free storage. And this was brought up by the Austin Homelessness Advisory Council, who is a group of 16 people who are either currently experiencing homelessness or recently have experienced it. And in these meetings, they meet every 2 weeks, and they kept on bringing up the need for storage. As a lot of people, after housing, storage is the biggest need, because almost everyone has a story about being on the streets and all my stuff was stolen and I had to start over again at zero. So IDs, vital documents, personal, sentimental things, your bedroll, things like that. People can't go into restaurants or use, public transportation or go to doctor's appointments or job interviews if they have to carry around 5 bags, So we prototyped with a Homelessness Advisory Council what this would look like. We did focus group sessions with members of the community and members of AHAC embedded in the groups, designers, architects, civic servants, looking at what it would look like, what it would take to get this done. So we presented that in front of a city council, and they approved it and had it become a directive in 184 last year that the city needed to make this happen. So with AHAC's support and the guidance of our service design lab, we opened up that storage facility. And I think that's a great example of creating something with people and not just for them.
Yeah, and I remember on the storage project, you did engage a lot with the design community. So it's another way that we can reach out and make sure that other people can get involved in these projects. So my next question is for you, Alan. We know that Community First Village has become nationally known for your approach, and it's more than a home. You also do a great job working with partners across the community to make some things happen. So what possibilities are you excited about as you start to expand the village now?
Well, as I mentioned a little earlier, we're in the process of designing another 126 acres that'll have 1,400 homes. And how do you scale from where we are right now, from 51 acres to something that's 170, 180 acres, 1,800, 2,000 people? How do we move from this community environment that we are in? And our on-staff architect, who has been working on all that planning and has also been living here in the village for 3 years, has now architected what we call these neighborhoods of knowingness. And if you come out to the village, it's cool, but there is some separation from some type of housing units versus other type of housing units. And the housing units themselves have all been extraordinarily successful, but how do we blend those closer together to create stronger neighborhoods? And that innovation is something that we're really excited about. We call it an innovation, but reality, it's not so much. It's really returning to our human roots as to how we were operating really 80, 100 years or so ago. And then we got isolated through our respective bubbles in our respective neighborhoods in our single family, what I call the hermetically sealed single family sarcophagus of our single family subdivisions, have actually done a lot to break up community. But our partnership levels is something that is really something that's growing and something that we're also excited about. I think we all realize that in a lot of ways, all of our different organizations oftentimes end up in these silos. and how do we break these silos down and become more connected and integrated. And that's something that we're very interested in. One of the things that Mobile Loaves and Fishes recognizes is that it's really good at real estate development and building community, but there's a whole lot of things that lots of people are much better at. Family Eldercare happens to be one of the great partnerships that we have, and we're looking forward to building and expanding that relationship in the future. Integral Care obviously does behavioral health issues. They're on site, and we're looking for that relationship to grow even bigger. The Austin Travis County EMS, a little over a year ago, put a full-time EMT out here on the property that dropped our EMS calls by 50% out here. And that was overnight. And that alone, that metric alone can show you the innovative possibilities of what we can do. We're now in conversations with the Travis County Sheriff's Department, which has a crisis intervention team, about having an office out here as well. Austin Recovery, when they were healthy, were out here, but Communities for Recovery, and we have restorative justice practices here through an organization called Life Anew. And so really, for us, the innovation is exploring ways that all of us can break down our own respective silos and join together in the areas that we're really good at and come together for a common vision of mitigating what we see happening on our streets. Thank you.
Yeah, that's great. And it's a good reminder, like you said, it's not necessarily about creating something new. It's about reminding ourselves about what a community can look like. And so thanks for that fantastic example. So for Chantelle, I have a question for you about kind of the, we've heard of the gray tsunami. We know that our populations are aging, and our growing and aging population in Austin, that's happening. So I'm curious to know, how can we continue to improve our services for older Austinites and make sure that we're keeping housing and housing concerns at the focal point of that conversation?
Yes. Well, we know that the number of homeless individuals is increasing and will continue to increase. We know just in our community that over a third of the individuals living on the streets are older adults. We created a program that targets specifically older adults so that we could, as quickly as possible, engage with those individuals and get them off the streets. I mean, we are seeing, like Alan says, people are dying, and the older adults that are living on the streets have, compared to their counterparts that are housed, they have a medical age of 20 years that of their counterparts that are housed. We know that, we see that. The emergency rooms right now are work with some social workers at Del Seaton is telling us that, older adults are frequenting the ERs daily sometimes. Last week, we actually had a client that was in the ER 3 times, and most of the times it is because of basic needs like food and to get out of the element. So, what can the community and systems do? One is address the need for deeply affordable housing, specifically deeply affordable housing for older adults that's designed around their needs, if that's mobility needs, community-based. HMOs, for one, need to fund services, housing services that would help lift a significant number of individuals off the streets. What we're seeing in our money management program is that the average income for an older adult is about $900. And so taking $900 and trying to find a place to live in Austin is just, it's rare. And so deeply affordable housing, one, services that are shaped and scoped around the needs of older adults. Oftentimes we engage with individuals that aren't receiving the benefits that they're entitled to. And this could simply be Social Security retirement benefits. I can't, the number of individuals that are homeless because of not having income. And so services designed to address benefits enrollment, that huge food insecurity, and then, like I said, designing housing for older adults is also key. Our homeless prevention services is there specifically to target, those that are unstably housed, and to direct resources in that area to prevent homelessness, which I believe that there needs to be more prevention services as well to combat. Solutions are preventing homelessness by resources, support. We have learned through our money management and rep pay services, one service that we brought out to Community First is a service that takes the pressure off of the individual. We're here to manage the individual's benefit, Social Security benefit, and pay the rent for them to ensure that the first bill that's paid is their housing whenever they have housing, to ensure that medical benefits are always intact and there, and then addressing their other basic needs, recreational clothes, that sort of stuff. So.
That's great. Yeah, thanks. And your answer brought up a lot of, you mentioned some adjacent systems to the homeless services systems that are definitely part of helping to solve this problem. You mentioned healthcare, food, and then of course housing, and then I think the prevention piece. Yeah, underline exclamation mark. Yes.
Yeah, and I just want to say, partnering is, we are learning that we can't do this alone. There's not one agency that is going to solve and provide the full scope of services that are needed, whether or not it's for an older adult or not. Partnerships are key, collaborations, working together. And like Alan said, breaking down the silos across the community.
Yeah. All right, Tish, my next question was for you. You've worked on some of these innovative projects, not only here in Austin, but on the East Coast. And so we were wondering, what are your hopes for shaping not only innovation and solutions here locally, but more broadly on the national scale?
Yeah, when I first started this work, I feel like I had my healthcare silo on, the silos Alan was talking about with regards to thinking about how a smartphone impacts health outcomes. However, it quickly became clear that, a smartphone is literally a lifeline to a variety of things for a homeless individual. And you just think about your own self and your own use of your cell phone and what that means. And so very quickly, it became clear that homeless individuals' access to a cell phone is critical. And so now, for instance, we're focusing on how the cell phone can help meet social needs. In our pilot work, in our exit interview, we did not formally collect data on this. We are now, but out of 30 people, 6 moved into housing and 5 gained employment. And they told us the stories about how, they were able to stay in touch with employers and just our case managers, whoever it may be, to actually follow through with various services in the community and just navigate them easier than they would have. And so they really gave us their perspective about how the phone was critical in doing that. And so I think that, moving forward, just thinking about how this access to a smartphone helps meet a variety of needs for homeless individuals is key. I've talked about, some of these things with regards to medical needs or social needs, but the ability just to connect with family and friends also came across as a huge benefit. One of my favorite stories is how one of our participants told us how they were able to use their phone to get in touch with her daughter and hear the cry of her first grandbaby for the first time. And so that's just amazing. And I think for me, it just made me even rethink, what would my life look like without a phone, just where we've gotten today. And so I think that's what our mindset is figuring out how do we equip people experiencing homelessness with this tool, which provides a lot of advantages and assistance with meeting various needs across the care continuum to really help people meet outcomes from a variety of perspectives.
Yeah, thanks so much. And you prompted a question in my mind that I might have time to pose to everybody here at the end. So, Mark, we need to ask you about some of the new services that the city has started up for people experiencing homelessness as part of the response to COVID-19 and the pandemic. And so I was curious to know, kind of maybe some of the things that the city has learned as starting up these new projects to help meet the emergency needs now, but really to the question that you wanted to try to address at the beginning, in your opinion, what is the role for the city in addressing some of these services going forward?
Yeah, COVID has been really interesting in that, as terrible as it is, there has been, I've noticed an effect of people having more understanding and empathy for people experiencing homelessness. The city has 5 hotels now that it's leasing for over 300 people who are formerly experiencing homelessness, who are deemed to be the most medically at risk for COVID. And, that's because we all realize that we're all in the same petri dish. We all touch the same door handles at the gas station and things like that. So that has been an interesting opportunity, and to see like the food distribution network that's happened and the community come together for that. It's been really inspiring. But I think approaching this issue from an equity standpoint, we all should have the same rights, whether we're housed or not. And a lot of the rights that we have as housed people, I think we take for granted. Garbage service, safety. We all pay taxes, whether housed or unhoused, when we buy something. So as citizens and as human beings, what are the rights that we are afforded? We have to decide, what is the baseline human rights that a resident of Austin should have? And the residents have a say in that. We all have a say in that. I think we all can agree that safety is a basic human right that we all should have. And if you look at some of the conditions that people are living in these encampments, it's not safe. What can we do in order to provide some basic assistance to make that safe, so you can at least, start there, I think one thing the city could explore is, there's going to be a lot of people who are newly experiencing homelessness due to the economic effects of COVID, and they're going to be sleeping in their cars. And rather than relying on the Walmarts and churches of the world to step up and fill that need, I think the city could provide a safe place for those people to park, with their families or alone. Just as a baseline, you deserve to be safe, as a citizen, as a human being. Shontell mentioned earlier that a lot of residents experiencing homelessness go to the emergency room for basic human needs, and sometimes just for shelter, which is something that I observed a lot back when I was a paramedic. And that is a systemic flaw. That's something that is not sustainable. If you look at the cost of an ER visit versus what it would cost to house that person for a month, or more, I think that is not sustainable. And we have to look at costs versus savings versus who we are as a city and what we can invest in to make sure everyone has the same rights.
Thanks, Mark. And I think that today, if we're looking to inspire people to get involved, I think that that's a question for a democracy and for all residents can consider is, what's the basic level, base level rights that we all have as Austinites, and how can we influence positive change? So we are we have a little bit of time on our hands, and so I created a question that you have not had time to prepare for. But Tish, you told a great story about some individuals that you'd worked with and how, you know, on that one-to-one basis, you can really feel the impact of your work just with the person sitting in front of you. And I think, you know, as we're looking to make systemic change, it's often easy to forget that the forest is made up of trees, right? And so I was curious if you, Chantelle, Alan, and Mark, if y'all could share with us maybe an example of where on a one-to-one basis, you really saw some change in a client and you could see, you know, how you were helping to move the forest, so to speak. So I'll start with you, Alan.
Well, we get to witness this every day in an extraordinary way. I mean, just, you know, watching people move from the streets, and the average number of years of our neighbors that have been on the streets is 10 years. If you can fathom that, and then the trauma that comes out of that, and frankly, the distrust and the disbelief that also grows out of that, and what it takes to bring them into a community like Community First Village and overcome that is extraordinary. But over time, we watch people settle. We watch people get back into purposeful work. We watch people dramatically change their diet, their sleep habits, their hygiene habits. We know that drug use, we've done 5 studies over the 5 years that we've been open, drops 80% from the streets to the village. And alcohol use drops 60%. And these are pretty big victories for us. And then watching people regain their driver's license and go out and, you know, buy a car, even though they're a $1,000 beater, to be able to save their money. I love the story on the hearing the grandbaby cry. We had somebody saw a video that we had posted on Facebook several years ago on Mother's Day and called us and said, "I think the woman in that video is my mother," and it was. And so we're very anonymous when we're on the streets. But when we get settled into a community where we're valued and we're able to begin to take care of all the things that we haven't been able to take care of, there is so much fruit that is born out of that. And the collateral impact of that is so positive for our community. All the costs associated, you know, and the struggles that we're having. So we just have a lot of stories. I could go on all day long, but anyway, thanks.
Thanks for the taste. Chantelle, how about you?
The stories. Wow. There's so many. Astonishing the impact that providing a roof shelter over someone's head makes. Let me think of a story is one that has to do with benefits and housing. There was a gentleman that was homeless, I think going on 18 years. He was 74 years old, very, very well known downtown Austin. Everybody knew him, walked around with a little briefcase. And the Integral Care's host team was working with him and made a referral to our organization. He was older. And we assessed him and, checked in on his benefits, and he had never applied for retirement benefits, and, looked down a little bit deeper, and, he worked his 40 credits, paid into the system, and just never knew to apply. No one, was there. He never connected with anyone to help navigate, that system. And so, that's definitely in our wheelhouse. We want to claim that we're the experts on benefits, and especially when it comes to Social Security. And so we connected him to Social Security and applied for his benefits, and he ended up getting $16,000 critical issue payment that came to us, and we immediately was able to house him and he's still housed now. So, that is, a feel-good story, but there's so many, many more like that. Working with Community First Village, we, when they first opened, we, looked at our list, our waiting list compared to their waiting list. And, before you knew it, there were, 35, 38 individuals moving out, and which, kind of helped start the relationship of aging services at Community First Village. It's just heart-wrenching to hear the stories my team comes back with, just the struggles, looking at the mental health issues and the depression, the medical needs that are untreated, oftentimes not diagnosed. And like I said earlier, the individuals on the streets are dying at such a faster rate than younger individuals. So.
Yeah, thanks. And same question for you, Mark. What have you seen in terms of individual impact as it relates to some of your projects?
I mean, some of the most impactful, experiences I've had is working with the Austin Homelessness Advisory Council over the last year and a half, and making friends with all of those folks there. It was amazing for me to get a better understanding and empathy of what it's like to be, experiencing homelessness. And as well, I think it was mutually beneficial, like our friendship. Two of the members of that council are full-time employees at the Keep Safe Storage Center now. A lot of those, members in that council, it's really important that they know that someone is thinking about them and caring about them. And, I think outreach is a really important and often overlooked thing in city services because a cultural connection is really important. And as Alan's organization says it, community first. What is a home? It's not just four walls and a roof. It's a village. It's a community. It's a family. That's why a lot of times rapid rehousing isn't successful, because you can't just give a person an apartment for 3 months and expect them to just completely adapt to that after years and years of experiencing homelessness. There are a lot more things that need to happen. So I would definitely recommend that anyone look into how to do outreach and how to make a friend.
Yeah, thanks, Mark. You're right. In my experience, that personal connection, that really goes a long way. So my last question for everybody is, I know that our viewers now have been very inspired. They're all very hopeful, and they want to know how they can get involved in making homelessness rare, brief, and non-recurring. So I want to ask you what you would say to that question, and we'll start with Mark.
Like I said, I think outreach is really key. And you can make packs in your car that you can give to people that address immediate needs. There's a couple organizations in town that I recommend people follow to get more information. One is the Other Ones Foundation. Another is Free Lunch ATX. They cook healthy homemade meals for people experiencing homelessness and encampments. Those are two really great organizations that are doing great work that you can support just by Googling those names: Free Lunch ATX and the Other Ones Foundation. But beyond that, just making an effort to go say hi and talk to someone who's experiencing homelessness, and just get involved that way.
Yeah, I like to recommend that people make eye contact, and in the days of wearing masks, a friendly wave, but one of these days we don't have to wear masks. A smile and eye contact can help melt some of that stigma and just make people feel like they're part of your community, which we're all in agreement that goes a long way. Tish, I'll ask you next. What can people do to get involved?
So I definitely agree with what's been said about just, acknowledging people experiencing homelessness when you encounter them. That's something that also came out in our exit interviews. With regards to our long-term vision and where we would like this project to go, we really envision that, we will figure out a way to connect this intervention with existing services within the city to where all people experiencing homelessness will have unlimited access to smartphone technology. And that is a way that can be used as a tool for various programs. I mentioned about how we are coupling the intervention with bus passes on the phone themselves. There's a lot of other opportunities to do that. And so I think just thinking about that in terms of how do we really think about the smartphone as a tool. The one thing that I would also say is that it's more than what we have found in our work is that it's more than just giving somebody a phone. You know, our actually deep connections with the community partners, we think is it's a differentiating factor about what's making that stick from other interventions that may, just focus on giving somebody a phone. And so it's who's the face behind the phone and what services come along with that and what supports can be wrapped in there. And so that's what we're focusing on to achieve a vision where, all people have access to the smartphone technology, which is really a window into so many things to achieve outcomes across the care continuum.
Thanks. Shontell, same question for you.
Sorry about that. What can people do? I'd say number one is, ask questions. There's such a stigma around homelessness and lots of, it's a growing problem, and that's why, we're here. But ask questions, get involved. Donate for one, that's definitely helpful. Donations help support not just the boots on the ground, but our infrastructure and our design of new and innovative programs and services. Volunteer, advocate. We are in times with COVID. The affordable housing need, tell your elected officials to support affordable housing. The HEROES Act, for one, evictions we're about to get out of the moratorium against evictions. We are anticipating a lot of folks that, like Mark said, will potentially be living in their cars. This is a time that, we need more advocacy and attention for support around this issue. I said volunteer and get involved, wherever you think that you can help out. That would be great.
Yeah, all great advice. And Alan.
Yeah, stop yelling at the mayor and the city council and move your yelling to in front of the mirror. Because at the end of the day, this is our issue. This is our community. These are our neighbors. And the only way that we're going to be able to mitigate it is when we, the people, join together. And that's across the entire city to go do this and partner with everybody that we can partner with, including the government. But as long as we continue to abdicate this responsibility to any 1 or 2 or 10 entities, we're going to be stuck with this issue for a long, long, long time. I will also tell you that after years of working with the chronically homeless, the men and women that we work with exclusively, loneliness, I think we need an eHarmony for our older, long-term, chronically homeless friends. Right, Shontell? Because loneliness is probably the biggest unsolved issue. Because in every one of us human beings, no matter who we are, there's this just complete innate desire to be fully and wholly loved. And we would like to discover that missing link for our friends who all 100% desire to be fully and wholly loved, but maybe never got that experience. This has been great. Thanks, Taylor, and to the other panelists for this. Been an honor.
Yeah,
Yeah.
Thank you, and thanks for closing us out on an idea for some social entrepreneurs out there who might want to find a way to get involved. Yeah, thank you all for your time, and I'll turn it back over to Laura.
Thank you, Taylor. And thank you all for your interest in the past, present, and future of homelessness in Austin. As you've heard on today's panel, homelessness is a complex issue with dedicated people breaking down silos, creating systemic change, and making deeply personal connections. All three panels have been recorded and can be accessed anytime on atxn.tv. You can find them on YouTube, or you can visit austintexas.gov/homelessness on the Get Involved page. The City of Austin would like to extend a big thank you to all of our panelists, including today's: Alan Graham, Chantelle Goche, Mark Jankar, and Tish Mozan. I almost had it. Moczygemba, and our moderator for today, Taylor Cook, and the past moderators, Catherine Flowers, and of course, Judy Maggio. I'd also like to extend a big thank you to ATXN for making this possible, to Rachel Freeman for her social media coordination, and to Kim Caldwell for all of her hard work. And thank you again for tuning in.